Good afternoon. I'd like to call the May 11th, 2015 Human Services Committee meeting to order. First, I'm looking for an approval of the agenda. Are there any comments, corrections, additions, deletions? Seeing none, all in favor say aye. Aye. Opposed, the same? We now have an agenda. Next, we have public comment. Is there anyone in the audience that would like to address the board? Seeing none, we'll move on to the April 13th meeting minutes. We have a motion and support to approve those meeting minutes as printed. All in favor say aye. Aye. Opposed, the same? Motion passed. Next, we have a Lifeways update. Mary Beth.
I don't know if I should say good morning or good afternoon because it's noon, but good morning, still morning. An update this month related to activity occurring at Lifeways. First thing to let you know is related to our annual financial audit. It is wrapping up actually today as we speak, and they'll be presenting to our finance committee this week and to our full board next week. So next month I'll have a presentation to you in regards to the outcome of our annual financial audit. The other thing is related to capital improvements. We are working with Rick from the county related to looking at capital improvement needs and a bond, and hopeful that we will have something by next month. We were hoping to have it this month, but as you all know, we've had some unforeseen situations occur that we've tabled that. But we are working with Jason, who is the architect that the county works with related to some improvements for the front of the building, so we're anxious to move forward with that, as well as to the estimates for the roof repair needs that we have, both for our building and for our group homes. The other thing that I wanted to update individuals on, and it's not in the packet, but wanted you to be aware that there's planning internally related to the autism expansion that we're anticipating will occur starting October 1st. They're going to expand the autism benefit. Right now, the benefit is up until for the age of 5 up to their 6th birthday. We've seen significant improvements with individuals related to this benefit that we're providing. As I last recall, 26 individuals are receiving this benefit for children. We are going to be expanding that statewide up until the age of 18. So we did get some projected numbers about what would that impact be locally for Jackson and Hillsdale County, and it's roughly about 150 individuals that we're anticipating would actually be eligible. So we are expanding. We're working with our current providers providing this service and looking at expanding for beginning October 1st. But wanted you to be aware of that should you hear about this service being expanded within our community. The other thing that I talked about last month was around our substance use disorder services and the fact that we've had some challenges related to capacity, people really needing a different alternative than inpatient. We're moving forward with that related to the development of what in Washtenaw County is called a sober center, but what we're wanting to do here locally is actually call it an engagement center, because we don't want people to be under the impression that you have to actually be sober to go there. The whole point is that you are able to detox off the services, whatever substance that you're on. We went this past month and we're working with New Horizon, and also went and visited what Washtenaw has in place, and we're really excited about what they're doing, and we're going to be implementing that locally. But again, I just want to keep continuing to keep you appraised as to where we're at with that, but we are moving forward and hopeful that we'll have something in place before the end of this contract year. The other thing was related to where we are. We've had some discussions with with Mission, which is our regional entity, and with the Michigan Department of Health and Human Services and local Jackson HIO about looking at partnering with Lifeways and our region for becoming one of the innovative payment model structures. And we're really excited about that possibility because we do have a very diverse funding stream when we look at, and that's one of the requirements when you look at the SIMS project. So we're hopeful as we move forward that we can partner with the HIO on that, and I'll keep you appraised. The other thing that happened over the last month since I reported is Lifeways did receive an award from the Center for Family Health for their advocacy award that they give out, the community advocacy, and we're really proud of that, very happy to have been acknowledged for the work that we've done with the Center for Family Health to really integrate physical and behavioral health, so that's something that our board and our staff are very proud of. The other thing was that we have had 2 audits that have occurred this past month. They're audits, follow-up audits from the department related to autism and our SED waiver. You'll see some of the outcomes in the report here. We have submitted our plan of correction, and we have seen improvements from the last audit, so that's a good thing. Things, when they did the initial autism audit, we had only been up and running with that program just several months, so there were many things that we needed to work on, not just locally, but as a region, and we've seen significant improvement, so that's a good thing, especially as we look at expanding that program. The other thing that's happened since I reported last is every quarter we have what's called a Behavioral Health Summit, and we pull together various stakeholders within the community related to behavioral health, and this has actually been 25, I think this was their 25th quarterly meeting, so it's been going on for about 6 years, where we've brought community members together and to really talk about behavioral health needs within the community. One of the things that was shared as an outcome is related to the HIO and the work that's been done where they do their community needs assessment, and you'll see that in the area of behavioral health, they had significant improvements in that area. I would like to say that I think a lot of that can be contributed to the mental health first aid, because a lot of the questions are about people knowing where to go to access services, and do you know what the symptoms are, and we're seeing improvement in our community related to that. And we'll continue to see that, because another item in your packet is about Project Aware, which is a joint collaboration between the Department of Health and Human Services, Lifeways, and the schools to really get mental health first aid. And that's one component. There's actually 2 components. That's the one component is making sure that anybody that has any interaction with youth, everything from down to the bus driver to the teachers, that they're trained in mental health first aid for youth. And then the other component about Project Aware is really to look at where are there breakdowns in access to care for children. So they're actually forming a joint collaboration with community partners, that there will be an ongoing committee that will be looking at those issues and really trying to break those barriers to access. So I wanted you to be aware of that. We are having an event in May, and be great to see anybody that would like to attend, because it's something that I'm very passionate about, is suicide prevention, and we're having our annual coalition Stomp, and it's made up of representation throughout the community. It's not just a Lifeways event, and it will be at the Cascades on the 30th at 10 o'clock, and we've actually far exceeded our fundraising efforts. We had set our threshold at 3,000, and right now we're at about 6,000. So we're really excited about that and hopeful that we'll have a great turnout. Last item in your packet is related to some legislative update. I don't know if you are aware, but the House Committee did pass some auto reform legislation. It's now going on to the House or to the Senate, and we'll see if it passes there, but it does put some limitations on the threshold for the benefits. So I don't know, just want to keep you informed, because it does have an impact on behavioral health services, so for people that are ongoing receiving. And that is my update. I don't know if there's any questions of the committee.
What questions or comments might you have for Mary Beth? Seeing none, thank you, Mary
All
Beth.
right, thank you.
Next on the agenda, we have the medical care facility financial reports for your review. And also at the medical care DHS meeting last week, I believe it was, the audit came through with no issues at all as well on behalf of the medical care facility. On the agenda next, we have Department on Aging. Ms. Marcy.
Good afternoon. This month, I'm primarily focusing on home care services, in-home services. Here we go. And our mission is to help older adults live full, active, and independent lives, which meets the strategic priority of healthy community. And we do that through two components. We want people to keep active through our nutrition programs, enrichment classes, going to senior sites. That's the best prevention, is to be active and involved, be volunteering, have good nutrition. And then the bulk, though, of the services through the Department on Aging are home services to help people live independently at home for as long as possible. And that's through personal care, which is bathing assistance, homemaker, which is lighthouse cleaning, as well as chore, which is installing grab bars and stair railings, and then in-home respite, where we have workers go into the home and stay with someone who needs care 24 hours a day so that the caregiver can go out and do their own errands. And for services that we have through the Older Americans Act, the Administration on Aging, we don't charge a fee. We do have suggested donations or cost share. So what happens is when someone asks for an in-home service is one of our social work staff go and meet with the person, or if it's a caregiver situation, with the caregiver and who we call the care recipient, the person receiving care. And there's an in-home assessment, and it is done using a laptop. And part of this list shows all the different components of an in-home assessment. Look at various areas that impact a person's life. And then we target those with highest need. It's not first come, first serve. So with relation to homemaker service, we do have people, our target area is people who are under 225% of poverty, which is $2,207 a month, one person, around $3,000 for two people. What we're saying is, if that's your income, then if your assessment points based on the criteria that I just mentioned, income, handicapper level, what resources you have, what physical needs you might have, you might be on a waiting list if your assessment points are 16 or less. But we do have an income ceiling, what we call a ceiling, that if your income is $3,400 a month, we are going to explain to you what resources are available. This is for homemaker only or bathing assistance, but because we're targeting lower income, we give people in this income bracket what we call a private hire list. So all of the agencies in the community that are available to do homemaker or personal care, and you pay them yourself. It's not on a donation basis. So I went through that quite quickly, but I just wanted you to be aware that those who have a higher need because of their situation, they're put on the list before someone who has a lower need. So people with a higher need are assigned a home care worker first. But if income is of 350% of poverty, or greater, then we again talk with people, tell them what resources are available, and we give them what we call a private hire information so that they could hire someone on their own to do that work. Now, this does not include I'm not talking about Meals on Wheels or respite. This is specific to lighthouse cleaning and bathing assistance. So I just wanted you to be aware. We started this about in 2014, and I mentioned it at that time, but I just wanted to review it with you. See if there were any questions. Okay, great, thanks.
Thank you for that presentation. Next, we have the Health Department update. Richard?
Good afternoon, Commissioners. Good to see all of you today. My report was submitted and is in your packet, of course. There's been, I provided quite a bit more information this afternoon concerning kind of the status of Ebola and Ebola screening and monitoring, if you will, on both a nationwide basis and in Michigan. We've really not been significantly affected in the state overall. There's only been about 183 people that were actually monitored. No one in Michigan has actually met the risk factors for actual laboratory testing through the MDCH lab for Ebola screening. So things have been really pretty calm for us, relatively speaking, with this particular outbreak. Good news, in addition to that, I believe that the World Health Organization is very close and may have already declared Liberia to now be Ebola-free. So of the 4 original West African countries that were really stricken by the Ebola epidemic, we're down to just 2 now. Sierra Leone and Guinea are still fighting the battle. So we're making a lot of progress on that on a world basis as well. We had a very nice visit from Sue Moran and Mikkel Robinson on April 15th. They are, Sue is the Deputy Director for Population Health and Community Services now in the new combined state Department of Health and Human Services. She had scheduled this meeting with us and actually tried to schedule it earlier in the year, but we actually were finally able to meet with her on April 15th and provided with her with a lot of information. I thought that her comment that I included in my report was very positive. She was very impressed with the level of community collaboration and our community action plan, and she's referring to the community action plan that we developed as a group through the Health Improvement Organization here in the community. So we were very pleased and had a very successful visit with her. Public Health Day at the Capitol took place on April 22nd. Unfortunately, Senator Mike Shirkey wasn't available for a presentation of a Friend of Local Public Health Award. However, we were able to connect with him last Friday over the Human Services Building and made that presentation to him. So it was very positively received, and we were happy to recognize him for all the work he did to help put the Healthy Michigan Plan in place in the state. We've been very busy with a number of other things in health integration. Community integrated resources is one of those things I discussed on page 2. This may not seem all that significant, if you will, to actually come together with a mutually agreed upon calendar of health promotion topics between the health system, Jackson Health Network, and the Health Department, but it actually is very significant because what we're doing is we're aligning with community action plan priorities, we're aligning with the quality measures of the Jackson Health Network, and we're aligning with other high-risk issues, if you will, or concerns that we have for the population health in the community. So it took us about 2 months to put this together. It integrates both all those things as well as national health promotion observances that we felt were relevant for Jackson County and fit those all together very nicely. So it was a very nice activity to engage in. We did not receive the Primary Care Outcomes Research Institute grant that Dr. Klinkman at the Jackson Health Network had applied for. This would have expanded the successful depression screening and management model that he had worked with here in the community for depression screening in 4 primary care practices in Jackson County. Unfortunately, we weren't able to successfully compete for that one this time. However, some of the elements that he had built into that application are moving forward, particularly qualitative interviews of patients in the community and their experience with accessing mental health services. So we're going to keep moving forward even though we weren't successful on that one. Spreading community accelerators through learning and evaluation. Hey, that's an exciting opportunity. It's going to help us jumpstart some more of our health improvement activity. And Dr. Schultz was instrumental in helping pull that particular application together through the Robert Wood Johnson Foundation. And if you saw some of the recent media coverage on that, we were the only community in Michigan selected to participate in this particular project, and only one of 20 nationwide. So we're very pleased to see that happened as well. I participated in the first annual research symposium with Allegiance Health. That was on April 15th, and it was a poster presentation that went along with the behavioral health survey that we did with primary care providers that was completed earlier this year. State innovation model planning continues to move forward. The Community Health Innovation Region Capacity Assessment will be completed this month. And again, I continue to emphasize, I think we're in a very good place to compete as being one of the pilot test counties, if you will, or communities for the whole state innovation model. The Jackson Health Plan Corporation is winding up their board activities, if you will. This month, we expect to pass a resolution that will dissolve basically this particular health plan. And that has all come about as a result of the Healthy Michigan Plan being put in place, as well as people being able to access care who were previously provided care through the health plan, whether in Plan B or Plan A, if you will. And I won't go into a lot of details about that, but suffice it to say that they are now getting coverage through other venues. And so there's no longer any match opportunity with local resources through the Center for Medicaid and Medicare Services. So the plan does need to close, but the good side of this is that about $1 million has been provided to the Community Health Foundation here in Jackson, and that will establish an endowment. Those purposes to continue to provide services in one way or another to the medically underserved members of our community. So that's a very good outcome. A press release from the Community Foundation was part of my packet this morning. We are always excited when we can share moments of excellence with you, and Marcia Hills Hoxie shared a very nice one that occurred with the client family in the month of April, and I'll let you kind of peruse that at your discretion, but it's nice to be able to see that staff really will step up to the plate and serve people when they need some help and they have questions or concerns. In this particular case, it was about a baby's growth that the family had concerns about. We're still hoping that the Strong Start grant with Meridian Health Plan will move forward and that we are going to be able to position one of our registered dietitians at the Center for Family Health to directly connect up with their client population for maternal and infant health program referrals. We're hoping that we can put that in place. We've worked very closely with Meridian Health Plan on the whole budget document for that, and it would be up to 20 hours per week. And I think what we're going to be able to use this for, too, is to demonstrate kind of on a pilot basis over a period of 6 months, if we're really able to effectively increase our referrals for this program, that we should consider keeping one of our staff members there for that very purpose. And I think it would be either budget neutral or we may actually increase revenues as a result of more enrollments. So we're optimistic about that. A couple of fundraisers that took place in the month of April that we participated in. National Child Abuse Prevention Month and an annual March of Dimes fundraiser. Both of those we participated in at the Health Department with our staff. Our Rotary Club and immunization promotion campaign is moving forward. I think that I know there was a meeting on April 22nd to discuss the specific pieces of the plan that we had put together that the Rotary Club is interested in moving forward on. And a small steering committee has been formed to help guide the direction of the radio and print messaging that's set to begin in June. So we're excited to partner with the Rotary Club. Lots of activity in health education and health promotion. You can see we had an update, our annual update that takes place with school secretaries took place in the month of April. I think it was on the 22nd, if memory serves me. And that was very well attended and very informative for all the school secretaries who have not only responsibility for capturing and communicating and inputting, if you will, all the immunization information for kindergartners, 7th graders, and any new children transferring into a school district. So they do all that work. In addition to that, they also are our key points of contact for routine weekly communicable disease reporting to the health department. On May 15th, that's Friday this week, I'll meet with the superintendents to kind of bring them up to date on the new school waiver rules for immunizations and also talk with them about the successes that we've had with increased communicable disease reporting. And I'll share that with you next month as well. We received additional $10,000 in Teen Pregnancy Prevention Initiative funds through Michelle White and her work, so we're excited to see that additional piece of money come in. We also hosted Operation Homefront. Some of you may be familiar with that. It's an annual military baby shower type event that was held at the Human Services Building on Sunday, April 19th. And expectant moms attend and receive nice gifts, including a free convertible car seat. The Office of Highway Safety Planning donates those. And 10 certified passenger safety technicians were there, including our staff as well. So it was I think that some of the comments that we received from some of the other certified child passenger safety technicians present is worth mentioning. They were very impressed with the setup that we have here in Jackson County and the resources that our local car seat safety program has available to our residents in the county. E-cigarette update. I won't go into detail about Senator Boxer's letter, if you will, to executives of the 5 largest e-cigarette manufacturers, but the bottom line is what we're seeing happening is that youth, in particular, we're seeing this in our MiFi survey results here at the local level as well. There has been a general shift in the percentage of youth that are now trying to access and use these e-cigarettes, if you will, as a replacement for smoking tobacco. There has been a bill that was introduced in the legislature. It did not go anywhere last year, died in a lame duck session, but right now, today, e-cigarettes can be purchased by minors. And unfortunately, we don't want to see that continue to be the case. Nicotine is still an addictive drug, and it's still harmful, even though it doesn't come packaged in a tobacco cigarette. The other thing we're seeing as well is that, and I'm not exactly sure who's doing it in what venue, but vaping has also involved other kinds of drugs that now are kind of available on the open market. You may remember hearing me talk previously about synthetic marijuana. There's a new one that's out on the street. I haven't seen it appear here yet in Jackson County, but we received an alert about it last week, and that was shared with our county administrators and a wide group of people within the community and law enforcement and health who should know about it. But it basically causes the same kinds of problems, if you will, that the other versions of synthetic marijuana have caused. Extreme agitation, irritability, and potentially death if too much of it is ingested. Some of that material has now been found to be vaped in these e-cigarettes. So it's another kind of a venue, if you will, for people to absorb and take advantage of this kind of a product that really shouldn't be on the market in the first place. So we're watching that very closely, and I hope that the legislature will put a bill together that the governor is willing to sign that will make them illegal for purchase by minors. Over on page 6, our WIC breastfeeding peer counselor positions have been successfully filled, so we have both of those staff starting in the month of May. Our county employee flu shot survey that I've talked about previously was launched last week, and we're hoping to learn some important information from that from county employees to learn about the circumstances under which they might be willing to increase the flu shot uptake, as well as some of the reasons that they choose not to. It's just part of a continuous process improvement activity on behalf of the county. We also did some work in the month of April on the topic under environmental health of fundraising guidance for licensed food establishments. The first version of that document is part of your attachments today, but since meeting with Chairman Shotwell and Vice Chairman Duckham and the county administrators, we're going to do something a bit broader than that. It'll probably go beyond just licensed food service facilities, because I think there are lots of questions that we still need to answer about what can we do in the community as far as fundraising is concerned.
Administrator Overton, would you offer information?
Yeah, I just wanted to chime in on that, just for the benefit of the board. You know, we did, at our regular Friday meeting, we invited him to come and speak to us a little bit about that, because we didn't understand how it affected churches and nonprofits and stuff, so we want a little more detailed information on that. That's what he's referring to there.
Yep. And we will do that. Always glad to see our staff move up in terms of their skills and abilities. Catherine Daniels, who's one of our new registered sanitarians at the Health Department, recently passed that particular examination through the National Environmental Health Association, and we were now able to promote her to Sanitarian 2 as a result of that on her anniversary date. So we're glad to see our people move forward. The animal shelter is pretty busy. We've had staff there that are trained certified in euthanasia procedures now. This is not something that we previously did with our shelter attendants, but we're able to do that. But we do think at some point in time, probably later this year, there will need to be a review of the job duties and responsibilities that we have gradually kind of added to their responsibilities on a daily basis in conjunction with the salary survey and the study that we're going to do in the county. Successful animal adoption event on March, actually 26th, 28th, 29th, with the shelter participating in that at the Tractor Supply Company. We were able to adopt out 9 dogs and 1 cat. Don Hayden continues to do shelter presentations, and tours are always happening at the animal shelter. He talked in the month of April with an 11th grade economics class at Northwest High School. So there's always lots of requests that shelter staff are responding to. It is intake activity at the bottom of page 7. It is cat and kitten season again. And so we're always kind of expecting that to happen. But overall, as you heard Don talk previously, we've actually made a lot of progress in reducing the overall intake numbers for cats at the animal shelter. It's probably dropped by about 1,000 over the past 2 or 3 years. And that's really a combination of factors, but probably the biggest thing is the community cat spay and neuter program, and I think we had that take place actually last weekend. There's a couple other things that I'd mentioned that aren't in my report. There have been a couple of different House bills introduced in Lansing concerning medical marijuana provisioning centers. Just wanted you to be aware that local public health in the state is actually opposed to the way that these bills are currently written. It's not that we don't think they should necessarily be reviewed, inspected, and regulated to some extent, but they're tending to classify marijuana, they call them medibles, which is basically taking extractions from marijuana either through a rendering process that uses butter or another rendering process where they actually boil it to create an oil, and then that is used in the cooking process, if you will, for making brownies or other kinds of things that can be sold over the counter in these particular facilities. So the bills either would allow them to do that, to sell or not sell, but the bottom line is they've built in a requirement potentially for local health departments to inspect these facilities. Well, the reality is, first of all, what's being added into the food product is considered a drug and an adulterant. So there's nothing there that we should be doing as far as public health is concerned in inspection capacity, because what we're doing is we're treating it as food under the food code, and it's not food. It's an adulterated product. So we've been kind of working with the sponsors of the bill and Michigan Department of Agriculture and Rural Development staff to get them to understand this is not something public health should take on. It shouldn't be written in such a way that we can simply go and establish a fee for doing inspections. We think that MDARD should take responsibility for this because it's basically food processing. So, want to let you know that that's kind of percolating out there, and there are always a number of other bills that we're monitoring as well, but if they have significance, I will always bring them to your attention. That's my report.
What other comments or questions might you have for Richard? Seeing none, thank you.
Thank you.
Thank you for that informational report. Next on the agenda, we have the April claims. We have motion and support. All in favor say aye. Opposed, same. Claims are paid. We have other meeting minutes. We have June reporting schedule, which leads us to public comment, the second public comment opportunity. Seeing none, are there any committee member comments? Seeing none, we'll adjourn to the call of the chair.